Good evening and welcome to Dr. Melissa Medicine Woman. I am so delighted that you have joined me this evening. Thank you so much for tuning in. We will go through part 2 of the pause. We have been talking about menopause and perimenopause. This is a topic that so many of you ladies have asked me to discuss. And so we are here to go through it, and then we'll have time for those Q&A in a little while. So menopause. What is menopause? Well, menopause is when you stop having a period for greater than 12 months, okay? 12 consecutive months. And there's changes in your hormones. So it's really when the ovaries stop producing certain female hormones, the progesterone and the estrogen. It means you can no longer become pregnant. So there's certain things that can actually trigger menopause to start. Surgery, including a hysterectomy or an oophorectomy, that can happen. Family history of early menopause can make you go into menopause earlier. Smoking can actually cause you to go in menopause earlier. Typically, it does happen between the ages of 45 and 55. And like I said earlier, it is when you start having those changes and fluctuations in your menstrual cycle. And the pause can lead, since the perimenopause can start anywhere from 1 to 5 years. You could be in this transition. When you do have 12 consecutive months where you've had no period at all, that means you are in menopause. So let me just go through my disclaimer for you here tonight. This show and all the content are for educational purposes only, not intended to diagnose, treat, cure, prevent any disease or psychological disorder. A specific physician-patient or pharmacist-patient relationship is necessary before any medical therapies are initiated. Please consult your physician, pharmacist, or other qualified healthcare provider with questions about your medical conditions and before starting or using any dietary supplements, herbal remedies, exercise, or nutrition plans. So, who is Dr. Melissa? So I have over 26 years of experience in both Eastern and Western medicine. I am well versed and able to talk to you about various disease states, medications, and supplementation. We discuss whole body health because it all plays a role together, both physical, mental, spiritual, and emotional health. And I'm able to help you and walk alongside you on your healthcare journey. I do have over 52,000 clinical hours. I speak with hundreds of patients a week, and I've helped thousands upon thousands to optimize their health, living healthier lives, more vibrant, more vitality, able to spend more time with their children and their grandchildren and their spouses and have the energy that they need and be able to optimize the amount of medications that they take. I am called the root cause doctor as well as the medicine woman because I do help you get to the root cause of the problem and peel back the unnecessary medications and supplements. So my physician friends do call me a de-prescriber, and I am your concierge consultant pharmacist. And I am so happy to be with you here tonight, speaking about the pause, part 2. And last time we discussed supplements and those supplements that are crucial for you to be on to help with some of the symptoms and to help with some of the preventive things. Tonight, we're going to discuss some of the hormone replacement therapy and the pros and cons behind it. And then we'll wrap it all up together here very shortly. So let's talk briefly about those symptoms again, because I do want to refresh our memory, or if you're joining us just for the first time tonight, then you know that you've heard of different things that can happen with perimenopause and menopause. And they can be the hot flashes and the skin flushing. It can be night sweats, insomnia, mood swings, from depression to anxiety to irritability. Irregular menstrual periods, as we talked about, as one of the key signs and symptoms. Vaginal dryness and vaginal irritability. We will talk specifically about that here shortly. With painful sexual intercourse and what you can do to make it so that you can still enjoy that even while in perimenopause and menopause. There could be joint pain. It could lead to potential risk of bone loss, osteoporosis. We talked about that last week. So things that are helpful that are non-hormone related, you can layer your clothing at night if you're having the night sweats. Sleep with a fan on or a light sheet. Try and avoid caffeine and alcohol and spicy foods, because those are things that internally make you hotter. Okay, so if you can cool down your core temperature, that's going to help with those hot flashes and the night sweats. Sometimes eating soy can actually help reduce the amount of hot flashes that you're having. Keeping yourself moving and being able to move about and have a regular movement schedule, so that you're getting and able to have your functional movement, walk up and down the hallway, walk up and down the stairs. Those will keep your muscles key and help your overall health. Following a good nutrition plan. The Mediterranean diet or lifestyle is a very good plan to follow. For the most part, it has everything that you need, and it can be helpful for a variety of different conditions. And I did talk about that before, so be sure and pop over and check out that episode on the Mediterranean. So let's talk about hormone replacement and medications. First of all, I'll talk about some of those non-hormone medications. And these are not supplements as well. So these are prescription medications, and they're prescribed often to help with those mood swings, sometimes the hot flashes, and some of those other menstrual symptoms. Now, most of the time, these fall into the class of antidepressants. Paxil or paroxetine, Effexor or venlafaxine, bupropion or Wellbutrin, and fluoxetine or Prozac or Clonidine are the top medications that are prescribed to help treat those mood swings and those hot flashes. And they're very well versed to be utilized because they do help control depression. And so when you're having those mood swings or those irritability, so these medications can help. Now, this doesn't mean that it's a long-term thing. It could be a short-term thing that you're taking these medications. Several of them, especially the venlafaxine, has been shown to help with those hot flashes. I have had several clients who are taking venlafaxine. They were put on it specifically because of the hot flashes, and then they had a boost in their happiness because it did help with their, they had a little bit of underlying depression. So let's talk about the hormone replacement therapy. Now, hormone replacement therapy has been around for many, many, many years, and has been the main treatment for menopause symptoms, okay? So many physicians in the past have believed that hormone replacement was good for reducing menopausal symptoms. It also helped reduce the risk of heart disease and bone fractures. Now, they used to think that. However, there are newer studies that have shown that hormone replacement therapy can actually put you at increased risk of breast cancer, heart disease, and strokes, and blood clot. So for many, many years, we thought that it was the benefit. And now there's later studies in the last few years that show there's actually more of a risk. So we have to weigh the pros and the cons of whether that hormone replacement therapy is the right thing for you, because your body's not making those hormones anymore. So do we need to give you those hormones back to help get you through the time period of perimenopause and going into menopause? So we're going to talk about the pros and cons of the hormone replacement therapy. So hormone replacement therapy is a therapy that has been approved by the FDA. It does help to treat bone loss. Okay. So there's beneficial effects with the bone loss. Estrogen deficiency definitely helps with that because we're putting the estrogen back into your body. Now, with that, it has the subsequent help with those hot flashes, to help with the night sweats and the skin flushing, because those are a result of less estrogen in your body. So when we put those in there, we definitely see a beneficial effect when you're on hormone replacement therapy. Less hot flashes, less hot flashes, less night sweats, flushing. Now, the vaginal dryness, the vaginal irritability, painful sexual intercourse, that has been shown improvement with hormone replacement therapy. So you've got to look at the pros and cons, because there is some cons to hormone replacement therapy. And we'll talk about those here briefly in just a minute. And so you have to, with anything that you're taking, you've got to sit down and you've got to weigh out the pros and the cons. So what's this going to help me with? Do you need to look at your symptoms? How severe are your symptoms? Okay. Now, if your symptoms are very mild, then hormone replacement therapy may not be the right thing for you. It may be just a supplement like we talked about last week. So you've got to weigh the pros and cons. What else are you already taking? How is it going to affect your lifestyle? Okay. Now, typically those who are younger than 60, which anywhere between 45 and 55 is when we start having the perimenopause, we'll see some benefit from the estrogen. Now, there's contraindications to hormone replacement therapy. If you've already had a blood clot, if you're smoking, then those are not ideal things for you to be on estrogen therapy, hormone replacement therapy. So we have to look at that, okay, because that could increase your risk. Do you already have a heart condition? If you already have that, then that could put you at increased risk if we're putting you on hormone replacement therapy. We look at your age. We look at the time since menopause, okay? So some people go through periods of time where they've been in menopause, and then all of a sudden they start having symptoms again, okay? They start having the hot flashes. And so we have to look at that and say, okay, do we need to go ahead and put you on something now? Well, we have to look at your risk. We also, the other risk that we consider is breast cancer, because if you have a history of breast cancer, then you should not take hormone replacement therapy. If you have heart disease or heart issues, like we talked about earlier, you should not take hormone replacement therapy. If you have liver disease, hormone replacement therapy is not the ideal thing for you. If you have a history of hormone-related thromboembolism, or you have an arterial thromboembolic condition, so you get blood clots frequently, or you've gotten blood clots from being on hormonal contraceptives in the past, not ideal for you to be on hormone replacement therapy. If you have endometriosis, then that is not an ideal thing for you to be on hormone replacement therapy. Okay, so we have to look at those things, and we have to look at specific things for you. So just because it's good for your friend or your neighbor, it may not be the best thing for you. Just like with supplements, your friend can recommend a supplement for you and you want to try it because she's your friend, but it may not be the best thing for you, and it can interfere with something else that you're already taking. So we have to look at that. Okay, now we drill down into specifics, okay? What particular hormone replacement therapy is best for you? So we drill down and we look at, okay, do you need estrogen by itself, or do you need estrogen with a progesterone? Okay, so there's two different kinds out there. What strength of the medication? How much do you need? Some people need more, some people need less. Do we give it to you in a pill form where you swallow it? Do we give it to you in a patch form? Or is it something that needs to be inserted into your vagina? There's all different forms out there. Now, we have to look at that. There's also some gels out there as well as sprays, but those first kind of routes were the general. Now, how long do you need to be on this? And when do we reevaluate you? Those are things that we need to take into account. Okay. So as you're sitting down and discussing with your healthcare provider, your concierge pharmacist, or your physician, you've got to look at the whole picture. Okay. It's just like whole body health. We've got to look at all of these things. And with hormone replacement therapy, how is it affecting your emotional and your mental state as well? Because that is key. You know, if your feelings of irritability, then we need to look at that. Okay. Is there, what type of hormone replacement therapy, how much do we need to give you to help you with that? Do we need to supplement with those non-hormone replacement therapy, like those antidepressants? Okay. So let's talk about the specifics in hormone replacement therapy. Now, estrogen is one of the components. It is a medication that has an estrogen-like effect. Okay, so it's not the estrogen that's in our body, but it's a pseudo type. Okay, it has an effect to treat the symptoms of menopause. Okay, and like we said earlier, it can be used on its own, or it can be used with progesterone. Okay, now typically, if you have had a hysterectomy, which means your uterus has been removed, then that is a case where you could be on estrogen on your own. Okay. If you still have your uterus, then we typically need to give you progesterone. Now, the progesterone is not given every day. It's only given a certain number of days throughout the month. Okay. So we have to keep that in mind. Now, there's other things there's manufactured pharmaceutical grade pills, capsules, tablets, transdermal patches. And then there's hormone replacement therapy that is very specific, compounded for you. So if that's the right case, then you need to make sure you find a compounding pharmacy that can do that for you, and a provider that can write for you that specific information. Now, it's going to have a component of estrogen, and it may or may not have a component of progesterone. So the progesterone, so if you've not had a hysterectomy, then you need to take that progesterone. Okay. Now, the reason that you're taking the progesterone if you still have your uterus is because it does reduce the risk of cancer in the lining of the uterus. Okay. So that's the key thing. The progesterone post-menopause helps to reduce that risk of cancer in the uterus. So that's a lot of information, I know. And yes, so let's talk. Let's see what you're going to have out there. You're going to have like estradiol out there. You're going to have conjugated estrogens. They're going to come in forms of the oral route where you can swallow a pill or a capsule. They're going to come in forms of patches, gels, and lotions. They come in all shapes and sizes, whether it's compounded specifically for you or you're taking a commercially available product. There's vaginal products where there's suppositories, there's tablets, creams, and rings now that are placed into the vaginal area to help reduce those symptoms. Now, sometimes that is done on a daily, weekly, or monthly basis. Various forms have different durations durations of therapy time, and how long overall you're going to be on that particular medication. Okay, so we do have to look at that. What is the pros and the cons, the risk and the benefits of being on all of this particular hormone replacement therapy? Now, I would recommend that you do a combination of things. Okay, so tonight was to talk about more the hormone replacement therapy side of things. As I mentioned earlier, layering your clothes watching what you're eating, watching what you're drinking, alcohol, caffeine, things that can impact your hot flashes. Are there things that can impact your other symptoms or signs of menopause? Now, when we look at hormone replacement therapy, we've talked about the good things that it can do. It can help reduce those symptoms. It can help to reduce the risk of that bone loss. Okay. So, and normally when you go into perimenopause and menopause, you add a higher risk to having osteoporosis. Okay. So we talked about last week about supplementation. Now there's some protective things with hormone replacement therapy to help protect against that osteoporosis. And then we also talked about why hormone replacement therapy may not be in your best interest. Because if you have a history of heart disease, if you have had a history of clots, blood clots, then that is not an ideal thing for you. Now, hormone replacement therapy, just like supplements, like you talked about last week, there's side effects that can happen. So the most common side effects that are seen with hormone replacement therapy with the estrogen and the progesterone: breast tenderness, nausea, bloating, leg cramps, irritability. So when you're putting in not your own estrogen, but now we're supplementing estrogen, you can have irritability. So oftentimes that's when a non-hormone replacement therapy, such as one of those antidepressants, is added to help with that irritability. Weight gain is a possibility with hormone replacement therapy. Okay. Now, when we're putting hormones back into your body. So if you remember that when we started talking about what is actually menopause, okay, so that's when you have irregular periods, and then all of a sudden the perimenopause, so goes to menopause, where you haven't had a consecutive period for 12 months. We're putting, because of the drop in the hormone levels within your body, now we're putting hormones back into your body. So you could experience some breakthrough bleeding. So that is a possibility. Now, long-term effects of hormone replacement therapy. Now, this is not to scare you. This is just to inform you and let you know these possibilities, because that risk of thromboembolism or a blood clot or a stroke or cardiovascular disease is a possibility that has been seen in studies of women who have been put on hormone replacement therapy. Now, that has been dose dependent. Okay. So the higher the dose, the more risk. Okay. Now, over the last 50 years, there has been so many changes in hormone therapy. Okay. So the risk has gone down, but it is still there. You do have the risk of breast cancer, ovarian cancer, endometrial cancer, the risk of dementia, and the risk of liver disease. So these risks that are associated with being put on a hormone replacement therapy, the risk of uterine cancer if you're not taking a progesterone. Okay. So if you still have your uterus, you have a higher risk, especially if you don't take that progesterone, of having the uterine cancer. Now, these risks, that's why there's contraindications if you have a history of blood clots or a history of heart disease, a history of breast cancer or liver disease, that hormone replacement therapy is probably not the best solution for you. And that is because of the studies that we've seen of things that can happen. So each of you are very unique, and I am so honored that you're here with me. And that's why we sit down and we go through what is the most appropriate thing for you. Okay. We look at you. What's going on in your life? Do you need the emotional support, the physical support, as well as the spiritual support? Okay. So when we look at your health, What is the right thing for you? Do you need a little bit of everything? Do you need a little bit of supplementation? Do you need a small dose of hormone replacement therapy along with a small dose of a non-hormone replacement therapy to help with the mood swings? That's something to look at. And if you need that for a short period of time, that's great. And then you want to be able to get off of it. That's awesome as well. Now, there's a time and a place for both Eastern and Western medicine. I'm not telling you that you should not be put on a medication or you should not be put on a supplement. There is a time and a place for both. And we have to determine what is right for you as far as being on that particular medication and knowing that it's the right thing for you. So sit down, write your questions out, ask your provider who's prescribing this for you. Sit down and talk to me about your current situation. What are you going through? What is going to affect this? What is going to be the best thing for you to be on as you're going through this perimenopause and menopausal phase? Because each of us, while we have similarities, each of us is very unique because you were created uniquely, just for you. Now, I do have an offer for you here. I do want to talk about briefly, and let me pull that window up here so that you may see this. If you go to drmelissabalizan.com/TV, I have a special offer just for you who are watching us right here on TV. Yes, we are live on TV. And go there. You'll have the opportunity, drmelissabalizan.com/TV, the opportunity to go in and to book a consult with me, to ask your questions, to sit down and review what you're already taking, what medications, what supplements. You're going through menopause. Let's sit down and have the conversation. What is the right thing for you? Okay, let's talk about that. Let's make sure that you're living your best life and that you can have whole body health and look at your physical, mental, spiritual, and emotional health, because we want to make sure that you are utilizing your gift of health that is keeping you alive. So thank you so much for watching tonight. This is Dr. Melissa, the Medicine Woman. Thank you. Make sure you listen to your body. And remember, you're only given one body, one life. Live your best life now and live your healthiest life. Have a super healthy, amazing day.